Hello, people. Let me go into more detail. If some of you wouldn't have looked up all the aspects of this, why I say it's such a high risk. Funny enough, for a first world country, it's like anybody knows in a third world country where you're having sufficient healthcare or the tests, even test all the people. You need a huge amount of test kits to test the people for one, and people that get really sick, that need intensive care because of the pneumonia. Both lungs get, people that get severe cases. Now, most of the cases, the people that have, at higher risk are people from 60 over. So your elderly are at the most risk from this, or underlying illnesses, smokers, heart issues. Those are the people with a higher risk. If being ill, and you're going to end up with intensive care, being stuck on oxygen, and possible death to hypoxia, lack of oxygen to all the organs, because that's what happens. Both lungs get serious pneumonia. It's very dangerous. And it's very dangerous to the old. So when you've got, first of all, a lack of healthcare facilities, poverty, and things like that, the reason why I'm saying this, funny enough, for America, which worries me, is because of the way your healthcare system is set up, purely profit-driven. It's purely now you've got the most at risk are your poor areas and your uninsured. Now, due to all this lately, because of these healthcare companies being, so it's all profit-driven, that if a few of them, corporations own most of the hospitals, they have shut down most of your good facilities. Hospitals in the poor areas have been shut down. So where you've got poor areas, low income, there's very little access to good health, to hospitals, to these facilities. Secondly, to self-quarantine, that also can cost money. That means you'd have to have the masks, the gloves, and you're going to be having to stop going out, having any contact. Everything would have to be delivered to your home. So this is why I say the risk is so high in America, because you have a lot of people, even if they are insured, as you know, everyone living from paycheck to paycheck, haven't got the money to pay for the costs. If they know they get ill, they're going to be lambered with the costs. First of all, for the test, then for treatment, then for quarantine, for vaccine. All of these are at high cost. So unless your government steps in, like it does with the banks, to bail them out, and the government waivers profit this time for the coronavirus. So when it comes to a pandemic or something like this, a widespread virus, where the government says, right, all of these will then be free to public to prohibit the spread. So that means those who are poor, who have no healthcare or little healthcare or no extra money, that aren't going to be able to afford to go and have tests, to pay for the quarantine, to pay for the treatment. And the scary thing is, what happens to the elderly and the poor and the low income if they do get severity, especially the elderly? They will not be able to afford the intensive care bill. They're going to end up homeless or on the street because of the cruel system, because your healthcare system is set up purely profit. It does not put patient safety, health first. It purely puts profit first. So this is why I say it's a concern that this could become a widespread pandemic in America, because people are not going to come forward. They can't afford to self-quarantine. They can't afford the bill to quarantines unless the government steps in on a case like this, where it's become so privatized and purely profit-driven. And this would make it blanket free. So it'll be free tests for coronavirus, free quarantine, free medical treatment when it comes to coronavirus. Is the only way you can stop a mass spread or pandemic in your country. Because I'm worried with the system you have, it's also financialized and purely profit-driven. It's discouraging people to admit, to come for test, to go for treatment, because they haven't got the money. They cannot afford the extra cost. They can't afford to be in default on their rent because they can't afford the bill. They're going to either face jail sentences or they're going to be in debt. It will financially destroy so many people because your healthcare system is so horrendously privatized and purely focused around profit. So I think the government, all governments should actually, as far as this sort of thing goes, and especially with the elderly and sick, vaccine should waiver the costs, should be provided free to that. Or it's greed. So if, as usual, normally tops, so if greed drives the market, well then that's what will happen. but that will also cause a financial collapse of their own doing. The markets are already, as I say, extremely, they have never recovered. But if so many people then, if it gets so widespread and so many people can't afford, they're going to default. They're not going to be able to afford these bills. And they won't have a choice. You're sick, you can't help being sick. So these are my concerns. And it shows a pure risk and danger of having such a system set up purely based on profit. Anyway, so please take heed, and I hope people are actually thinking about this. This is a danger. It's extremely dangerous, and I can understand why Bernie Sanders is pushing for free healthcare. This won't be the only virus outbreak we have, and it can be absolutely catastrophic if you go at it this way, because you are really going to keep people from coming forward, and people cannot afford to buy the equipment, buy the gloves, buy the masks, and self-quarantine in the first place. Never mind even afford the treatment, or they'll probably die on the street because they haven't got the money for the treatment. No one will treat them free of charge. Thank you, people. Bye.